So it used to be that when lasers first came out, they said that darker skin tones couldn't use it because of the heat absorption. But has that changed now with the different types of lasers, or is that still an issue with darker skin tones and laser therapy?
It's still an issue. For some reason, people of Southeast Asian descent, regardless of how light or dark their skin is to begin with, are at higher risk from pigmentation from lasers. We don't really understand why that is. It is what it is. And so when we're treating people from a Southeast Asian area, then we will maybe be more cautious with the settings that we use. We'll use lower energy levels or lower density and say, okay, let's shoot for more treatments, but I feel we can still get an equivalent result. We're just getting there slower. And so we use a lot of fractional lasers or fractional types of devices in those patients. Maybe a fractional laser, like a laser that I use commonly is called Fractional, but there's other devices out there as well. Maybe among the most common devices in Southeast Asia is RF microneedling, because it combines the benefit of microneedling with an energy source. But by bypassing the skin with the needles and then firing the energy, you don't heat that top layer of skin, so your risk of pigmentation is much less. That's typically the most common issue that I've seen in people of Southeast Asia, also maybe African American patients or South American, Central American patients, is pigmentation issues, primarily hyperpigmentation, which means an increase in pigment.
Do these treatments get very expensive, or are they relatively affordable?
It varies. It varies a lot. Number one, based on where you're getting treatment. Here in the United States, Beverly Hills versus Topeka, Kansas, it's going to be a very different cost for a patient. So where you are does matter. What kind of device you're getting treated with will matter a lot. How many sessions you need. I'll give you an example. When we're treating scars, I don't give people a number as to how many treatments they need, because scars are unpredictable. It may never be normal skin, no matter how many treatments they do. But what I tell them, and what we know for sure, is that each time you treat it, it will get better and better. So I leave it somewhat open-ended, and I tell people, let's do one, give it a month, see what you think. If you're happy, let's do more. If you're not happy, come back in and we will discuss. We'll get some photos and see, if it's worth changing the plan or if it's worth doing another one and kind of dipping our foot in the pool one more time. So costs can be very variable. It's hard to come up with one general answer to that.